Hello and welcome. I'm Jennifer Cardellini, Director for Consumer Information at Benjamin Rose Institute on Aging. Thank you for joining us today for Washington Update, sponsored by Benjamin Rose Institute on Aging and the Elder Justice Coalition. Today's webinar will discuss developments in Washington, D.C., including the new administration, 117th Congress, and the new majority in the Senate. In addition, our presenters will provide a preview into key aging policies, including new COVID-19 emergency relief, equity issues in healthcare and services, what might be in store for Medicare and Social Security, and prospects for new caregiving legislation. This webinar will be recorded. We will be sharing the link with all of you in an email in the next week. Please feel free to share that with colleagues who could not join us today. We have a lot of information to cover in the next hour, so we will hold questions until after all panelists have presented. However, you may submit a question at any time using the control panel on the right-hand side of your screen. Now I'd like to introduce our presenters. Our first presenter speaking today is Orion Bell, President and CEO of Benjamin Rose Institute on Aging. He joined Benjamin Rose in 2019 with more than 30 years of leadership experience in not-for-profit management. Prior to joining Benjamin Rose, he served as President and Chief Executive Officer at Sequoia Aging and In-Home Solutions, the largest of Indiana's 16 area agencies on aging. Our second presenter is Bobblancato, President of Bobblancato and Associates. In that capacity, he also serves as the National Coordinator of the bipartisan 3,000-member Elder Justice Coalition, the Executive Director of the National Association of Nutrition and Aging Services Program, and National Coordinator of the Defeat Malnutrition Today Coalition. Last but certainly not least, our final speaker for today is Meredith Ponder-Whitmire, Vice President of Bobblancato and Associates. She is the Policy and Advocacy Director for the National Association of Nutrition and Aging Services Programs and the Federal Policy and Media Coordinator of the Elder Justice Coalition. She also directs policy for Defeat Malnutrition Today. I will now turn it over to Orion Bell.
All right. Well, good afternoon, and thank you for joining us. And I want to take a few minutes and talk about caregiving and caregiving policy that we will keep an eye on in this session of Congress. And one of the first questions might be why caregiving? And there's a couple of reasons for that. One is that we are beginning to see some critical mass around caregiving as an issue. This quote from the National Academy for State Health Policy, that we really don't have a nationwide statistic about this. We have a lot of estimates, but sort of an awareness there. If I go to the next slide, please. The Kaiser Family Foundation reporting how much of long-term services and supports are provided by family caregivers in the uncompensated care as a part of that, and the fact that long-term services and support account for over half of all of the spending in Medicaid in the states. And so there's a financial incentive and a social incentive for doing this. Next slide. And one more. So there are some recommendations that are coming forward around family caregiving and family caregiving support. There is a new report out that lists 5 of these as primary policy recommendations for states, and these include focusing around information for caregivers, expanding the availability of the services and supports available for caregivers, looking at workforce issues in the long-term care space, looking at financial security and employment policies and how those affect those persons who are caring for a loved one, and finally looking at stronger collaborations between public and private organizations and the public agencies. And so that is an area of focus in the policies. Another reason, go to the next slide, please. Another reason to look at family caregiving is just the timing of a couple of things coming together. And one of these is the ReYES Family Caregivers Act. This is a 3-year authorization to establish a family caregiving strategy. It has a variety of participants in it, including consumers, federal agencies, and folks with expertise in the space. We go to the next slide. And as part of their effort, in November of 2020, 26 recommendations were adopted by the ReYES Family Caregiving Advisory Council. This is the coordinating body that was established in the Act, again, toward establishing this national strategy and creating a roadmap for policy and strengthening supports and strengthening networks for caregiving in the U.S. Next slide. And so part of that is, and it currently is that the Administration for Community Living will be developing an inventory of the existing programs and services that are available for family caregivers across the country. And there will also be opportunities for public comment as this list is put together, as the recommendations are put forward, more opportunities for community input and public input. This was the case in 2020, and many of the people on the call may have participated in one of those listening sessions, but there will be more activity around that in the new year. Going to the next slide. So also within this space of the discussion about family caregiving is a focus around grandparents raising grandchildren. And this is another area where an act was established to create this advisory around grandparents raising grandchildren as a growing issue in the United States. Again, a process for public input and a multi-agency and multi-stakeholder council that was established to help guide awareness on this. So if we go to the next slide. This again is a advisory council that has put this one in case 22 recommendations about advancing kinship care and the strategy around that. It also informs the National Family Caregiving Strategy and also is aimed at federal, state, and local policy and regulations and funding as part of the overall process for that. So we go to the next slide. So a part of this, and this is a Washington update, but a lot of the discussion around advocacy and supports for family caregivers are going to be state and local jurisdictional issues, not just at the federal level, because a lot of the focus is around programs that are funded through Medicaid and Medicaid waiver programs, and those are state implementation policies. A lot of this is a discussion about employment law, and those tend to be enacted at the state level. Insurance regulations, state plans for aging, state plans for Alzheimer's, and other initiatives that are state activities. So even though it's a federal initiative and suggestions that are going to come and recommendations that are going to come, a lot of this is going to be things that will be enacted at a state or a local level. Likewise with local policy, things with tax levies, the kind of grassroots programming, all the local fundraising, the volunteer programs, all those sorts of things that are part of the network that exists today for family caregivers. So if we move on to the next slide, please. There has been a lot of work around development of listings of the types of regulations and services, and here's a listing of these that are currently in play. We're going to talk about a couple of these specifically. If we go to the next slide, I want to look at part of this is a discussion about financial support. And so there are a variety of laws that are on the books in some states, and quickly looking at a couple of these. This is actually from a report that was put together by the Academy on State Planning, and so there's this is an inventory of these that we're actually through the end of the year. And so there are 9 states that currently offer some form of paid family leave that is at a state guarantee for that goes beyond what the federal standard is for family medical leave. 20 states have a policy around paid sick days at the state level. 25 include caregiving responsibilities as an eligible category for receiving unemployment insurance. Many states have implemented spousal impoverishment protections as part of their Medicaid and Medicaid waiver programs in their states. And some, currently there are 18 states that have implemented some form of payment for family caregivers. A lot of these family caregiver payments have come into play as part of the state's responses to the pandemic and the awareness of the lack of access to the traditional services that might have been used for caregiver supports or long-term services and supports in those states. One state, and this is New Jersey, has actually enacted a caregiver tax credit so that where they recognize the ability of a caregiver to be able to take a tax credit for some of the responsibilities they have as a family caregiver. So next slide, please. So all of those items have a financial impact and a fiscal impact, and they will have their own, because of that, they will be more challenging in terms of having passage in states that have not enacted them already. One that is more widely adopted, there are currently 41 states in the District of Columbia that have adopted the CARE Act, and this is an initiative that was promoted particularly by AARP at state level, and so 40 states and the district have enacted this act. And it provides for some status of caregivers in terms of being identified in a medical record, provides a requirement that healthcare providers notify that family member who is the caregiver of record when their loved one is discharged or transfer in the health systems, and requires education and instruction for caregivers on the tasks they are to provide for their loved one. So the majority of states have enacted this, and it has some appeal in part because it does not include a fiscal impact for the state. It is a requirement for health providers, but it does not have a state tax implication or state revenue implication as a part of it. As you see from the map, there are 40 that have adopted this and put it in place. So go on to the next slide, please. So in looking at caregiving and issues around caregiving and the kinds of bills we just mentioned, AARP and sponsors every 3 years what is the term called a long-term services and supports scorecard, and it ranks states in terms of the quality and availability of long-term services and supports in those states. And one of the categories in the long-term scorecard is about caregiving and family caregiving issues. And there's a couple of indicators that are reviewed as a part of this, and they include the supports for working family caregivers. So that list that I referred to earlier about things like the tax credits or access to paid leave, those kind of things, those would be under the category of working family caregivers. Person and family-centered care, which gets to some of the questions about the spousal impoverishment or the ability of the caregiver to be involved in the care planning. And then nurse delegation and scope of practice is a third area, which is partly about the ability of the non-professional person to be able to carry out some of the caregiving responsibilities outside of the healthcare setting. And then finally, transportation policies fall into this one as well. So many states include some transport as a part of their Medicaid or Medicaid waiver programs that is in addition to whatever might be offered through the aging network. So this scorecard is looked at by a lot of state policy folks. It is generally used in kind of crafting some strategy around advocacy activity by AARP and others at the state level. And it was a 2020 report, so this would be the cycle that people will be looking at those as an item. So go on to the next slide. So there's going to be a lot of focus around and emphasis on adding or changing or expanding some of the supports for family caregivers. But at the same time, we should acknowledge there's going to be some headwinds that people will run into in looking at this. Many states are going to be looking at budget deficits in the new year because of the impact of the pandemic and the economic downturn. And many of these things that I mentioned do have a fiscal impact, and that'll be a part of the discussion in the state. There's also been a transition to, at least in one state that has been approved for a block grant for its Medicaid funding at the state level, and this is Tennessee, just was approved for that. And so over time, there's the potential that if funding goes to block granting and the population increases, the net effect is that there's less dollars available per capita to put on some of these programs, and that may create some financial challenges in terms of implementation of some of these programs as well. But despite all that, we do think there will be a lot of discussion and a lot of activity around caregiving. It's something that cuts across, it's a bipartisan issue. It cuts across the different parties. It cuts across the age demographics. And so we do think that'll be an area where we'll at least see some discussion and some efforts around building awareness, whether or not there's new legislation that comes forward from that or not. So move through that rather quickly, but just an idea of some of the things we're looking at in the caregiving space. And I think we will hold questions around all the topics until the end of the presentations. But thank you for the opportunity to talk about some caregiving policy that we see coming up in 2021.
Okay, there's some resources to complement Orian's great presentations, and I'll let them sit a minute before I go into who I am and why I'm talking here. Okay, Julie, I guess we can go to the next slide. So good afternoon. This is Bobblancato. I'm proud to be the national coordinator of the Elder Justice Coalition, of which Benjamin Rose is a key member, and we're delighted to be co-hosting this webinar with them to talk about a Washington update. And we are going to be, my colleague Meredith Whitmire and I are going to be talking about activities in Washington. And let's begin with, what is still stark in all of our minds, especially those of us who live in the nation's capital. Was the Capitol the scene on January 6th when that insurrection occurred that had the sole purpose of trying to disrupt the peaceful transfer of power from one president to the next? And then the same Capitol, 2 weeks later, achieving that peaceful transfer of power with a powerful, simple, but powerful inauguration that was held right in that same spot, meaning that the transfer was accomplished, and now the transformation from the past 4 years has begun. Next slide, Julie. So let's talk about big picture. This is the classic situation of the big picture. The president has identified himself the 4 simultaneous crises his administration is going to be dealing with: the pandemic, the economic collapse tied to the pandemic, the racial justice and equity issues, and climate change. Now, think about this. Any one of these issues could consume the first 100 days, if not more, of any administration. But they have to be confronted simultaneously by this administration coming to work. And work has started on all 4 of these issues because the president does understand, even if it's not right, he's going to be judged more politically on what is done in the first 100 days than the remaining 1,400 days that follow. Next slide. So let's start with the cabinet that the president has selected, and in some cases the Senate has confirmed. There are 3 elements to the choices that he has made for his cabinet and likely sub-cabinet and below: experience, familiarity with the president, and diversity and achieving historic firsts for different positions. And where better to start than our new Vice President, Kamala Harris, being the first African American and Indian American in the position, the first woman Vice President. Next slide. And then you go, a good sign for the future is that, and particularly working between the President and Congress, is that the most important national security and economic positions have been confirmed, beginning with Lloyd Austin, our new Secretary of Defense, a man with great experience, prior ties to the President, and the first African American to run the Pentagon. Next is Anthony Blinken, our new Secretary of State, just confirmed and sworn in yesterday. Another person with great experience and prior ties to the president. Then Janet Yellen, Secretary of the Treasury, a woman with enormous experience, former chair of the Federal Reserve. And I still shake my head when I read this line, the first woman Treasury Secretary in our nation's history. It's really hard for me to imagine that, but we now have one. And finally, Avril Haines, the Director of National Intelligence, another very experienced person tied to the president and the first woman to head that very important office. Next slide. And then there is a partial list of some cabinet secretaries who have been nominated but not yet confirmed, including Alejandro Mayorkas for the Department of Homeland Security, and he would be the first Hispanic in that position. Your own Congresswoman Marcia Fudge, who will be running the Department of Housing and Urban Development. Former United States Congressman and now California Attorney General Javier Becerra, who would be tapped to run the Department of Health and Human Services. And let's focus on why the prior experience and the prior Biden ties are important. This is an administration that has got to get to work right away. These are crises that are right in front of us, affecting our daily lives. But if you also think about it, if we get past these crises and get them into some degree of control, it could lead to some cabinet changes that could occur maybe halfway through the term of the administration versus going through the whole term. And there are many people waiting for that second chance. So let's go to the first crisis on the next slide, which is the pandemic. And it's hard to believe we're approaching really, I guess we're at 1 year from when the first case was detected, but we're really, in terms of when our lives were affected, we're approaching 1 year because most of us were affected in March. The president has begun aggressively to address the vaccine distribution issue, which is a problem in so many states. Most recent announcement made yesterday is that the administration is now going to purchase an additional 200 million doses of COVID-19 vaccine from Pfizer and Moderna, the two companies that remarkably, and let's not forget this fact, remarkably were able to produce this vaccine much faster than was ever anticipated in response to a crisis that we didn't expect. Next slide. And I'd also add that it was also announced that they're going to expand the number of people who can administer vaccines by asking retired doctors and nurses to join in the campaign to have as many people vaccinated as possible. And even before the cabinet was selected, the president chose a group to coordinate the pandemic response led by Jeff Zients, who's noteworthy that they have immediately, and you've seen this on television and you've seen it in what you read in the media, they are acknowledging, appreciating, saluting the role of science in the response to the pandemic, as we should. And as it relates to equity, the Centers for Disease Control today is expected to release some very important demographic data on vaccination rates, which are likely to confirm that minority communities are going to show lower vaccination rates. And a report that came out in the Washington Post this morning confirms some of that as it relates to some states, including the state of Ohio, where 13% of your residents in the state of Ohio are African American, but only 6% of the population so far vaccinated is African American. So you can see there is a significant issue there. And only 20 states so far in the country are tracking vaccination rates by race, which is something that has to be corrected. And obviously, when this CDC report comes out, it may lead to new prioritization being put forward and how to get more vaccinations to people. And as it relates to a greater response, and this comes from conversations that we've had and other organizations, aging organizations have had, that people are talking about, they're being asked in the Aging Network to help in this vaccination effort. Well, they need to be acknowledged for that work. And we are working to have additional resources go to the Aging Network when the next COVID emergency bill gets passed. A practical example is homebound older adults who are served for home-delivered meals and other services. For many of them, they're going to need to be taken to a place to get a vaccine. That requires transportation, which the Aging Network has and provides on a regular basis for things like medical appointments and other things. But this is an additional response and responsibility that's going to require additional resources. And we also hope to reach a point where for those homebound folks who are not able to get out for a vaccine, that there'll be a process to get them vaccinated in their homes at the same time they get their meals. But it's all about having the aging network recognized as a trusted resource that can help in this vaccine effort. Let's go to the next slide and talk about the second crisis, the economic collapse that has occurred since the time of the pandemic. We're just about, as I said, almost a full year into the pandemic, and certain sectors of the economy have been and continue to be devastated. The related impact on retail, travel, restaurants, and the corresponding job loss. And so far, the response to date from the Biden administration is the president's American Rescue Plan, a $1.9 trillion COVID-19 emergency spending package. Next slide. You know, there are many provisions in this proposal, but two that immediately are important. One is an additional $1,400 in emergency relief for millions of Americans to complement the $600 that was provided in the last COVID emergency bill back in December. And then something that was not in the previous bill, $350 billion to aid state and local governments, including funding related to testing and vaccinations. Because as this vaccination process ramps up, as we mentioned earlier, there are additional costs being incurred by state and local governments that need to be addressed. And we want to see this aid happening in this next bill because it's needed. There isn't a community in this country that isn't talking about budget shortfalls as a result of the pandemic, and this aid is very important. The status of the initiative will be discussed when Meredith moves to our coverage about Congress in this new year. But the administration on its own, using executive orders, has moved to extend, for example, the moratorium on federal evictions and foreclosures until the end of March, and extended the freeze on student loan payments. Next slide. On our third crisis, on racial justice, you know, this administration has been very active in this space since they took office. The most recent actions occurred yesterday with the issuance of 4 executive orders aimed at promoting different elements of racial equity. The first, ending reliance on private prisons by not renewing contracts that have been entered into by the Department of Justice with private prison companies because of track records that they've had on the treatment of inmates. Second, to undo actions of the previous administration in the housing, including making it harder for plaintiffs to meet the legal threshold for proving unintentional discrimination. The idea is to have the administration not be in a situation of making it difficult for people to prove discrimination. Next slide. The third of the 4 executive orders is to reaffirm the federal government's commitment to the sovereignty of tribal governments over their territory, an issue that goes back many, many years, but was particularly important to address at this time. And fourth, a memorandum related to the rise in anti-Asian sentiment that has occurred during the pandemic, including and especially the ongoing reference to the quote-unquote China flu. And finally, the disbanding of a little-known but recently got some attention, this controversial 1776 commission, which was created to promote quote-unquote patriotic education, unquote. Many elements of that were not good, and it was good that the president made this decision. And let's go to the next slide and the fourth and final crisis confronting the administration, which is climate change. Many of you saw yesterday our former Secretary of State, John Kerry, who's now our official climate envoy, did a press conference with Gina McCarthy, who's going to be running who's now the White House National Climate Advisor, or the Climate Czar, as they call her. But yesterday, the president signed, sweeping is really an understatement, executive order, creating a White House Interagency Council on Environmental Justice, creating an Office of Health and Climate Equity at HHS, creating a separate Environmental Justice Office in the Department of Justice, and then, very significantly, asking the government to spend 40% of its sustainability investments on disadvantaged communities which have often been targeted for hazards that others did not want: power plants, landfills, trash incinerators, and so on. So that gives you the perspective of a Washington update as it relates to the administration. And now I will turn to my colleague, Meredith Whitmire, to talk about Congress.
All right, everyone. So thank you, Bob, for that update on the administration. As he said, I'm going to talk about Congress. And to start, by virtue of the outcome of Georgia's special elections, which frankly, I did not anticipate, many people in Washington did not anticipate, but the Senate has flipped. The Democrats are now the majority because even though the Senate is tied, the tiebreaker vote is the vice president. So the Democrats have the power trifecta, the House, the Senate, and the White House. So with this flip come very important changes. Senator Schumer is now the majority leader, and there's going to be some interesting committee chair shifts. Your own Senator Brown as chair of Banking, Housing, and Urban Development, Urban Affairs, that has jurisdiction as over financial stuff, but also as it implies over housing stuff. So that should be very interesting. Senator Leahy is now the chair of the Appropriations Committee, and he is also the president pro tem of the Senate. He has the longest tenure in the Democratic Party. Senator Wyden is now going to be the chair of the Finance Committee, which deals with things like Medicare, Medicaid, the Elder Justice Act, which we'll talk about a little bit more, and importantly, nursing home reform, which Senator Casey was very instrumental in introducing several bills in the last Congress on, and he worked pretty closely with Senator Wyden. So having those two as committee chairs should be very interesting on that front. Also, Senator Patty Murray will be the chair of HELP, which is the Health, Education, Labor, and Pensions Committee. And that committee has jurisdiction over the Older Americans Act. Now, that was just reauthorized, so we don't, there shouldn't be too much activity on that front, but it's still good to know that a friend of the Older Americans Act is now in charge of the committee with jurisdiction. Next slide. So the House side changes are much less dramatic. The leadership is intact. You still have Speaker Pelosi and Steny Hoyer as majority leader. And some of the new chairs, because of retirements and congressional losses, include Rosa DeLauro from Connecticut as chair of Appropriations. She's also going to remain the chair of the Labor HHS subcommittee, which has jurisdiction over spending for pretty much all the aging programs I can think of. And she has been, much like Senator Murray, a dear friend of Older Americans Act programs and aging programs in general. So it's great news that she is now the chair of Appropriations. And then you have Congressman Bishop from Georgia as the new chair of the Agriculture Committee. So that's an interesting shift as well. And if I'm not mistaken, the Farm Bill will be up this session of Congress. Not necessarily, I don't think this year, but I think next year the Farm Bill is up. So more to come on that. Next slide. So on the agenda, the work of Congress is going to be paralleling the Biden administration's priorities, particularly because of that trifecta, especially related to both the health and economic aspects of the pandemic. And the first test of how things are going to be run is this Biden American Rescue Plan and what Congress ends up doing with it. There are a couple of choices. The one that the president is really hoping for is some kind of bipartisan agreement accepting this package or something close to it. There's also budget reconciliation, which is a pretty complex and arcane set of rules on, basically that would mean that the package could pass with only a majority of votes as opposed to having to get 60 votes, to break a filibuster. So if they can't get any bipartisan buy-in, they may have to go to budget reconciliation. And there's active discussion as we speak in the Senate and the House on how to proceed on this. The Senate has a group that some of the media are calling the Sweet 16, 16 bipartisan senators who are very much pushing for some kind of bipartisan agreement in the neighborhood of about half of Biden's plan. Leadership in both chambers, Democratic leadership, however, very much more interested in going it alone. There's also going to be this second impeachment trial coming up, and how exactly they're going to handle that. There's was talk as recently as today of if the president, loses the trial, if he loses the trial, he may not be allowed to run for office again. But if he wins, he could potentially run for office again. However, today there was talk of using the 14th Amendment to bar him from running for office again. So that remains to be seen. Also, there's talk of an infrastructure package and addressing climate change that way. I know the president would really like to see an infrastructure package happen. I sat through a lengthy discussion today about how budget reconciliation could also be used for that package and other climate change issues and all kinds of stuff. So more to come on that. Next slide. There are plenty of other aging issues that we're tracking, though. The Affordable Care Act, a perennial issue. Currently, the Supreme Court is deciding whether or not the entire thing is constitutional after the individual mandate was severed. So the aftermath of that decision, whichever way it goes, should be interesting. Also on the Affordable Care Act, the president has reopened enrollment for the individual marketplaces for the next few months because so many people have lost their jobs and, it's a mess out there insurance-wise. There's also prescription drug legislation that will certainly be coming back up. That was also a mess last Congress, but the president has expressed a lot of interest in reducing prescription drug prices. And the House managed to pass a pretty sweeping bill last Congress on that topic, but the Senate was not able to get a package together. So I think that's going to be a big priority for Congress. Something Biden campaigned on and something that a lot of, at least policy people, are interested in seeing is the expansion of Medicare to start at age 60 instead of 65. That is not only a fiscal thing because that would remove some of the most expensive people from the individual marketplace. It also, there's concern about people who lose their jobs at 60 or older and can't necessarily afford an individual plan but are too young for Medicare. So there's an entire gap market there. The president has also campaigned on ending Medicaid waiting lists particularly for home and community-based services. So hopefully some action will happen on that. Next slide. More potential legislation that could happen, reauthorization of the Elder Justice Act, which was part of the Affordable Care Act and lost its authorization. It expired in FY14, so it's been a while. The Elder Justice Act did receive a huge influx of emergency funding in December. $100 million will be going out to APS agencies and others. The exact breakdown hasn't been publicized yet. They're not sure. But at least half of it is going to APS agencies. There's potential talk of caregiver tax reform, credits for tax credits for caregivers. And frankly, there's also going to be some, I think, serious response having to happen to the trustees' reports when those come out on Social Security and Medicare. With job losses and the payroll tax cuts, we think that solvency, the insolvency date is going to be moved up a few years, making it very urgent for Congress to take some kind of action there. Next slide. And we've been talking about health equity. As far as aging goes, we really need to be placing a special focus on older adults who have endured lifelong issues like disparities, inadequate access to services. And we think it can be expected that consideration of any major aging issue will include a focus on what needs to be addressed to achieve greater equity. Things like the minimum benefit for Social Security when Social Security ends up being discussed. There are features of Social Security that are unintentionally discriminatory, but are discriminatory against women. For example, not being able to collect Social Security credits during years that they might be caregiving, for example. So typically, women end up with fewer retirement credits. There's also the issue of Medicare prescription drug prices, making sure that plans are affordable and that, we're interested in seeing things like an out-of-pocket cap that would be very helpful for people with significant health issues who, blow into the catastrophic phase. Also, nutrition security, making sure that people have access to nutritious food. Next slide. So, in other words, hang on, it is going to be a wild ride. We are very interested to see how this goes, what happens, and hope that there's that a lot of positive things happen for the aging world at large. So that concludes my presentation.
Thank you to all of our presenters. We have a couple questions that are starting to come through. I think Sarah's going to read some of those for all of you, and we'll let you know what portion of the presentation we were in when those questions came in. If you still have questions for our presenters, please feel free to enter those now into the question and answer box on the right-hand side of your screen. Sarah?
Thanks, Jenny. So the first question, I think this is for Orion, regarding services and supports available for kinship caregivers. How do you access them? Do they need a lawyer or need to devote significant time to access them? And do they need to have internet access in order to start the process?
So the current kinship care programs are funded in Ohio and in other states through some of the funding through the Older Americans Act, so there are some small programs that currently exist. The focus with the kinship care programs and the grandparents raising grandchildren is about expanding the availability of that. It's a patchwork of services that is as far as what's currently available, and it does vary from state to state. But there is Older Americans Act funding that is specifically for that purpose, and so in most cases it's something that would be best explored through contacting the local area agency on aging and finding out who the agencies are that are participating in that program in the local community.
All right, Orion, I think the next question is for you as well. In regards to the long-term services and supports scorecard, why the pushback in the Southeast?
Well, so the scorecard has I believe this is the fourth iteration of the scorecard being released, and the way the scoring is calculated, it looks at the availability of services in those states, and it looks at in part looks at the regulatory environment in those states. So while it is true that most of the low scoring results are in southeastern states, it's not so much that there's a pushback on those. It's just there was perhaps a lack of programming that was in place there in the first place. Typically states in the Northwest and the Northeast have had higher scores. Those are also states that have had large populations of older adults and programming in place for some time. But there is opportunity clearly in states that are dark blue on that map that would be able to improve in those categories. Some of the particular reasons for low scores in some places are around policy. Some of them are about availability of services. So states that have more rural populations may have lower scores in some of the access areas of that. And some of them are about the kind of policies that are affected, things like state law that exceeds the federal standard for things like family medical leave or paid vacation time tend to not be as those are less likely to be on the books in those states, and that accounts for some of the scoring differentials.
And Orion, I think I'd also throw in some of them also include states that did not expand Medicaid.
Yeah, that's true. Some of the states that are on that list are ones that did not do the Medicaid expansion.
Thanks. So this question came in, Meredith, while you were speaking, but I think anyone could address it. So if you don't have enough professionals to provide the services and support to the community, how do you expand the provision of those services?
I mean, I think that has to do with reimbursement rates for starters. You know, part of the reason that the workforce is shrinking, particularly in the direct care areas, nursing homes, that kind of thing, wages. And, Medicaid does not do a good job of reimbursing long-term care facilities and direct care providers for the services that their workers are providing. So, I think that is where some of the advocacy should start.
Yeah, I think the push now is to incentivize people to want to work in direct care because it's the need is there. The number of people needing the care is growing. This actually also is an element of immigration reform. We've got to be cognizant of the fact that the workforce of the future, if not the present, comes from having people that are immigrating to the United States come to work here. And so there's a lot of pieces that have to be sort of tied together, but it is true that right now, particularly in an economic difficult time like we're in, the wage factor and the benefit packages are just not sufficient to get enough people to do the work.
Thank you. The next question is there any special funding for evidence-based programs for caregivers, and how can we learn about those programs?
So I think I can take part of the question around the caregiving piece. There's an excellent resource for finding out about the current availability of evidence-based caregiver support programs. It's actually a project that's a joint effort of the Family Caregiver Alliance and the Benjamin Rose Institute on Aging, and it's Best Practices Caregiving, and you can find that at the caregiving.org website as well as on the Benjamin Rose website at benrose.org. There's a listing of all of the currently available evidence-based caregiver support programming that is available within the United States that have been vetted for effectiveness and meet the standard of being an evidence-based model. And just recently launched and there's plans to add some additional programs to that over the roster of programming in the upcoming year. As far as other kinds of caregiver support programs, a couple of other things that are being done but are not necessarily being done in the same way everywhere is there's looking at establishing caregiver assessments, things that look at the health and well-being of the caregiver, because we know that a lot of the impact of caregiving can take a toll on the caregiver in terms of their own health, their stress levels, their physical health, and other factors that are a part of that. And there is work in that space going on, looking at some standardization of what a caregiver assessment tool might be. That's another one of the recommendations that's listed in that group of proposals that were put forward by the ReYES Family Caregiving Advisory Council. So all of those are recommendations. They're not on the books. They are things that have been identified as targets to work toward, and would certainly provide a roadmap or a playbook on things we should try to advocate for to get put in place.
Thanks, Orion. And are there any likely future changes in the National Caregiving Support Program funded by the Older Americans Act?
Well, I'll start with that one. I mean, the law was just reauthorized for 5 years and signed into law by President Trump last March. And so the process by which you make changes is not scheduled. However, it is not unprecedented in the history of the Older Americans Act to have special opportunities to make changes in some parts of the law. And I think the pandemic may provide that opportunity, because not so much in the caregiving space, but if you look at what has happened with the nutrition program, which is the largest program in the Older Americans Act, it has been completely converted in the sense that it was a congregate program and a home-delivered meal program. And since the pandemic, it's now become an entirely home-delivered meal program. And the process of getting it back to what it was, the process of reopening, the process of all the things that are going to get the older folks to come back may require some legislative changes. I think you're going to see perhaps a greater appreciation. If we take up, for example, the growing issue of social isolation in this country, which is approaching, if it isn't already, a public health emergency, that may prompt the consideration of other legislation addressing that. That may provide an opportunity for the Older Americans Act to be looked at again. And, you know, the ReYES Family Caregiver recommendations, if there's enough political support behind them, could lead to the introduction of some legislation to amend the Older Americans Act. So there are possibilities. And I think that from the previous point, the 2020 Older Americans Act does have some preliminary language on caregiving assessment, which could probably be expanded in the future.
Thank you. The next question is, many grandparents need help, are in their 50s or younger, and aren't necessarily thinking about services and supports for older Americans that they might qualify for. So how do you address this disconnect?
Well, I can, speaking as a former Area Agency on Aging director, would say that those programs, that the Kinship Care programs, the grandparents raising grandchildren programs, are not defined by the 60-plus standard that is used for a lot of the Older Americans Act. There is not an age definition in the caregiving component of the Title III-E, the funding mechanism that pays for some of the caregiving programs. So, now that if the perception might be there that it's not available, and that might cause some people not to pursue it. But in terms of what is the policy that's on the books, or what the standard is, those services are available for in the kinship care setting, whether or not the grandparent or the non-parent family caregiver is 60 or older. So that is permitted. The biggest challenge with those programs is the level of funding. that there is not sufficient funding in the programs currently in most places to meet the need of everyone that would request it. And so, as is the case with many of the services, there may be a waiting list for that kind of programming in terms of the available slots. So that's a place to advocate for more funding. But the actual rule around what you can do with the money is actually pretty flexible in terms of the definition of the grandparent.
Great. And then sort of piggybacking off of the last question, what can you do about perceptions that the grandparents might have that are in their 60s, and how can you change their perception of being able to qualify for the benefits?
Well, I think that there's one of the challenges with any service program is there's not much in the way of a marketing budget to promote awareness of programs. And so it is very much something that happens at the local level, something that folks are relying on things like the 211 network or the Aging and Disability Resource Center in their communities for information about those programs, up to and including knowing that those programs exist and how to contact them. I think there is some opportunity, I think, for more discussion about funding and awareness of the various programs and the networks and how to access them. But in most cases, the organizations that deliver the support services around the family caregiving programs, they are integrated into their other program lines. They are, they have multiple lines of funding, not just the Older Americans Act dollars, and so there is some process in place within those agencies for the case management or case identification as to who would be most appropriate for those. And those are all local programs. And that's the other thing about a program like a grandparent support service like that, is that they're local by design. They're implemented at a local level to address a local community service, and so they might not look exactly the same in different areas, even within the same state. The funding has the same source, but the means of service delivery varies because an urban community or a rural community or a metro area may have a different set of needs and different resources available to address them.
Well, I think that's a great place for us to wrap up today. I want to thank all of you for your excellent questions and your participation in today's webinar. And thank you to our presenters for your great information. We will be having future programs that we hope you plan to join us for. If you are interested in learning more about programs throughout the year and would like to register for those programs, information can be found about all of our Benjamin Rose webinars and events at www.benrose.org. Thank you, and we do hope you have a great rest of your day. Take care.